guess Hi, women. My name is Adelaide Meadow, and welcome to the 5 Keys to a Healthy Bladder Masterclass. I'm really excited to be teaching this content because I think the more that we all know about our bladder health and function, the better we can support our health and our pelvic physiology throughout our lifetime. And considering the amount of women that do have some degree of bladder concerns, either chronically or perimenopausal or postmenopausal, is the majority of women in our culture, I think this is pertinent to all women. So I'm really glad to be covering this topic. A little bit about me, if you are new to my work. I am a physiologist, specifically focusing on the female body, so anatomy and physiology of women, and specifically from a pelvic health perspective. So addressing all of our common pelvic health concerns, really grounded in the unique brilliance of the female body. I approach our healing from not just a physiological perspective, but also an integrated and holistic health perspective, incorporating emotional, cultural, and historical aspects into our healing. I also have the incredible privilege of being able to attend home births, so attend women while they're birthing their babies. And I bring a lot of experience attending births and attending to women in their pregnancies and during their births and their postpartum period to my physiological knowledge and understanding. I am not a medical professional, and this is by choice and by design. I was on that track and I walked away from that course of study because I felt that it was antithetical to a lot of really accurate physiological information for women, meaning there was a lot of inaccuracies that were being taught, as well as a lot of conditions that are placed on the practice of medicine that I think are largely antithetical to integrative health in general. So nothing that I share here is medical advice, but rather physiological information that is based on helping us live our optimal, healthy, female-bodied lives. And all of this is totally learnable and discernible, understandable, and applicable to you regardless of your background. That's really my goal. I am no more sort of intelligent than you on any of this stuff. And I just want to be giving and offering physiological information that can help us all live better. And we are focusing now today on the bladder. So I'm going to give a little overview of what we'll cover in this class, and then we'll get right to it. So this is called the 5 Keys to Bladder Health, and we'll be splitting this into, unsurprisingly, 5 sections. So initially we'll cover the anatomy and basic function, both anatomy and physiology, right? Anatomy is the parts, physiology is how they work. So the anatomy and physiology of the bladder. From there, we're going to be going to common infections, and we're going to talk about just common bladder infections from UTIs to interstitial cystitis, the difference between urinary tract and bladder infections, and what to do about them. From there, we'll talk about bladder leaking, very common. I get a lot of questions about this. We're going to talk about the structural anatomy of leaking and what to do about it. Then we'll move on to urgency and frequency, talking about how they relate to everything we have previously covered, as well as the neurological impact of training our bladder. And then lastly, we're going to be looking at the emotional and integrated aspects of bladder health, which is often overlooked, but I know just intuitively many of us are familiar with when I get stressed, my symptoms flare, and we're going to look at why that is from a physiological perspective and really what we can do about it rather than just the trope, chill or don't be so stressed, because that generally doesn't actually assist our health. So we'll be going through those 5 topics, and then we're going to come to our 5 keys to a healthy bladder, which is really gaining, or like based off the knowledge that we would have previously covered, what are the 5 things to keep in mind if we're going to want to be optimizing this aspect of our bladder health, but really our women's health and our pelvic health more broadly. So that's what we'll be getting to. And then at the end, I'm going to go over any questions. I know many of you submitted questions, so we'll be going through all of those that I maybe haven't covered directly towards the end of the call. So if you are here live, welcome. I'm so glad that you're with us. And it is such a nice thing to be able to just just turn your camera on, introduce yourself if you'd like. And this can absolutely be an interactive class or experience. I know that most of you aren't here live, but for those of you who are, your questions are of service really to our broader community. I guarantee you, if you have something that wasn't clear or was confusing to you, that it wasn't clear or is probably confusing to another woman. If you've experienced something in your body, I guarantee you there's another woman watching this who has experienced it too. So your questions and your participation are really acts of service. And so I really appreciate any participation that you may be able to have. So from there, and that doesn't mean, I know I said we'll hold questions to the end, but if I am going through and you're like, oh, I don't get that, please just, put it in the chat or, raise your hand and I will call on you and we can integrate clarity throughout the lecture. So, all right, without further ado, let's get started with the anatomy and physiology of the bladder, right? So first of all, I like to refer to the bladder as the bladder balloon. And why I like to call it the bladder balloon is because it immediately gives a pretty clear picture of how this organ functions, right? Like a balloon, it expands and contracts as its primary mobile action, right? That's the primary, sort of physiological movement of the bladder is the ability to extend and contract. So the bladder balloon is made up of primarily two types of tissue. Right? And these two types of tissue make up a structure called smooth muscle. Smooth muscle tissue is a type of tissue that has a weave between fascial tissue and muscular tissue, specifically like skeletal muscle tissue. So this weave of tissue makes the unique structure of our organs, and specifically the organs that need to expand and contract. Think the lungs, the uterus, the colon or the intestines more broadly, the bladder, the respiratory diaphragm. These are all organs that are made up of smooth muscle because the way these organs function is through this expansion and contraction. So let's talk a little bit about the anatomy of these tissues. And then within that, the nerves that live within them. So if we think about nerves, we have many types of nerves, and these nerves live in different types of tissue. So let's start with skeletal muscular tissue, or just muscular tissue, not smooth muscle, to be clear. So muscle tissue has a primary action, which is supplicity, meaning the ability to extend and contract. And it has all these different types of nerves that live within muscle tissue. If you reach your arm out to the side and you just, can sense that it's out there, the type of nerve that is telling you that your arm is out to the side is called a proprioceptor. Now I want you to flex your palm, right, with your arm out to the side. And likely when you're here, you feel the extension of probably the forearm, maybe some contraction across the top of the arm. The nerves that are telling you that that extension is happening are called stretch receptors. So proprioceptors and stretch receptors primarily live within our skeletal or structural muscle tissue. And this makes up a significant amount of the tissue that creates the bladder. The other type of tissue that's woven into the bladder, the balloon, is connective tissue or fascial tissue. Fascial tissue has a primary mobility that is not to expand and contract, but rather to glide and provide support and structure. A unique aspect of fascial tissue is that it is non-vasculated, and this is crucial. Non-vasculated in the sense that, yes, blood flows around and through it, but the cells of this tissue aren't fed by oxygen moving from within our bloodstream into those cells in the way that is true for muscle cells. This is crucial because it minimizes any degree of an inflammatory response that can happen in this tissue. Why I like to bring this up is because the bladder is inherently designed not to become significantly swollen. And this makes sense because the fact that there's this interwoven connective tissue into the actual weave of the balloon means that it's not going to swell as though it was just a skeletal muscle like your bicep or your calf or something like that, because there's not as much vasculation throughout the tissue as a whole. Now, if we're going to talk a little more about the innervation. So we talked about some nerves like proprioceptors and stretch receptors that live within the muscular tissue. We have these other nerves that live specifically within our connective tissue. So nerves that live within the connective tissue are not super well understood. And why I like to talk about this, and you're like, how the heck does this relate to the bladder? Right, so we have all these nerves, specifically interoceptors and tissues that, which are nerves that tell what the body is doing sort of to itself, right? And these interoceptors, these types of nerves, aren't vasculated in the traditional way, as we just spoke about, which means they're not actually connected to our central nervous system. I want that to blow your mind, that we have the primary tissue system in the body, right, our connective tissue system, that is not vasculated in the way that all of our other tissues are vasculated, meaning the nerves that would live within that tissue is not fed and directly connected to our central nervous system, because we all know if blood gets cut off to a nerve, the nerve dies. So what about all these nerves that aren't directly fed through blood? Well, they're not directly innervated back to our spinal column and up into the brain, meaning there's an entirely other way or sort of independent communication system that happens throughout all of the nerves that are woven throughout our connective tissue. Meaning our bladder that has this combination of muscular tissue and connective tissue woven in to make the unique structure of the bladder balloon, right, has different types of nerves that aren't all innervated to the spinal column and to the brain, but instead other types of nerves whose the way that they communicate is more to the other tissues in the body and not incredibly clear from a physiological or a medical perspective. Why are we talking about nerves, and what does this have to do with the bladder? Well, the bladder primarily has two types of nerves, and we've already met one of these kinds, which is the stretch receptors, which indicate when a tissue is extending, right? Remember, you were flexing your palm, you felt this extension across the forearm. Stretch receptors are indicating when a tissue is moving into extension. This makes sense that these are going to be primary nervation within the bladder, because as the bladder balloon is filling with urine, as it is expanding, you want nerves to remark that and send that message to the brain. Those are innervated through the central nervous system, the stretch receptors, because they're in the muscular tissue. So it goes all the way through the central nervous system, and you have that sensation, oh, my bladder is filling. I have some pressure within the bladder balloon. The other type of nerve, and we haven't met these yet, are called nociceptors, N-O-S-I, nociceptors. Nociceptors are the alarm bells, so to speak, of the central nervous system. So rather than a pain receptor, because we don't actually have pain receptors, pain exists in the brain, meaning we interpret the messages from our central nervous system and arguably from our fascial nervous system to determine that something is painful. Why it's important to understand that these exist in the bladder, but not in the same sort of amount or density that we have stretch receptors, is we're not designed from a neurological level to have a sense of pain really associated with urination or with the filling of the bladder. Of course, we do need some of these nerves to live within the bladder, because say it's filling to capacity, we want that like, oh no, pay attention to this sensation over any other. That is the unique aspect of the nociceptors, is they have sort of a main line, a main track up into the brain. So the trajectory of these specific nerves back into the central nervous system and up to the brain is a shorter distance than other innervation, which is how you would immediately experience something that would be alarming, right? You would have that thought first. Say you're going to go touch a hot stove. The first thing that would occur would be a nociceptor response that says, oh, that's hot. And that would get to your brain prior to maybe a different type of sensation coming from a different nerve would say, oh, this is smooth, or, oh, this is, whatever other texture. While that information all would be entering at the same time, because it's the same initial sensation, it wouldn't actually reach the brain at the same time. And that's the work of your nociceptors. Okay. So the bladder, right? We have these stretch receptors primarily and nociceptors secondarily that live within the muscle tissue, not the connective tissue of the bladder. So let's talk about the nature of stretch receptors. Stretch receptors are unique in that the longer the duration of sensation, the duller the sensation becomes. So we're all likely familiar with this phenomenon in the body, in the sense that, say we go to stretch our hamstrings and initially it's like really intense and you're like, oh my gosh, the sensation is so loud and intense. And then after 2 or 3 minutes, the sensation is not as significant. That is a great example of the duration of sensation, meaning the longer those nerves were activated through the extension of the tissue, the duller the sensation becomes, right? So they chill out, so to speak. Which is why, then after a significant, or a moment or two of stretching or lengthening the tissue, that sensation isn't as significant. This is true for the bladder, meaning as that expands, as we begin to have that sort of stretch or expansion in the tissue, we might feel that pressure really intensely. Yet as it endures, that sensation often dulls. I think many of us have had this experience in the body where we are, we feel like we really have to pee. and we can't pee for whatever reason, there's not a bathroom nearby, and 10 minutes later, we still have to pee, but it's not as urgent. That's a great example of healthy bladder function, where the stretch receptors are minimizing their noise or their message, so to speak. And so the tissues can actually relax. Now, this is crucial, this aspect, because understanding how these nerves function within the bladder can give us a key to what might be going on with our bladder health. I was recently speaking with a woman who was in her late 50s, early 60s. She was experiencing some degree of bladder prolapse, and she had lost the sensation of having to pee. She's like, I never feel like I have to pee, which that in and of itself gives us a great indicator as to what might be going on physiologically, right? If we know that that sensation of fullness in the bladder comes from the expansion of the bladder balloon, it is likely that the tissues are in a locked long state, meaning that the muscle tissue within the bladder is extended, so that therefore, as the bladder fills, those stretch receptors aren't being activated. And so therefore, she doesn't have the sensation that the bladder is filling. Why would that be important? Well, then we likely have an indicator as to what could be useful for helping her regain that sensation, which is going to be gathering more tone within the tissue of the bladder, right? How do we actually hug in? How do we support the tissues around the bladder to give it more support, so that as it would fill with urine, those stretch receptors would be activated and we can start to reignite that nerve sensation of stretching as the bladder fills, right? Likewise, let's take this in the other direction. Say you're someone who, the moment your bladder starts to fill, you instantly feel like you have to pee. This is another great way where understanding the innervation is going to be of service to you. Because, say that's the case, the moment the bladder starts to fill, you feel like as though you immediately have to pee. You likely have essentially really restricted tissues within the bladder. But then what occurs is then when we immediately empty the bladder upon that sensation and don't actually allow that sensation to endure and see if it minimizes, meaning, yes, we still have to pee, but it doesn't feel urgent, right? We're allowing the stretch receptors to extend and expand and therefore minimize that pressure within the bladder, right? However, if we never allow that to occur, right? If we never allow the bladder to fill, allow us to relax, and then fully void the bladder, then we start to miss out on that full balloon-like function of these tissues, as well as the corresponding nerve responses. Meaning, as the bladder fills and contracts, right? It's allowing these nerves to move, and it's allowing us to accurately interpret the sensations that are coming from the bladder. If we pee immediately every time we feel as though we have to pee due to that sense of urgency, we start to minimize and hypersensitize the nerves within the bladder, where anytime there is even that subtle amount of stretch, we interpret it as through our nociceptors, so through our alarm bell nerves, as being something that requires immediate action, which would be to void the bladder. That pattern over time of frequent urination or feeling urgent and not being able to go for 2 to 3 hours without emptying the bladder generally exacerbates and builds over time. So maybe you feel like you have to pee every hour and a half, and then you do that, and then it might feel like every hour, and then it might feel like every 45 minutes, because we're continuing to limit the function of our bladder from a neurological perspective, right? So this is the basics of the anatomy and physiology of the bladder in terms of how it is constructed through both skeletal and fascial tissue, right? As well as how it is innervated through both stretch receptors and nociceptors. The last thing I want to be really clear about in terms of the structure of the bladder is, why is it made up of connective tissue and not just muscle tissue? Well, one, it's an organ, so we want it to hold its shape consistently, right? So though it does expand and contract, we don't want all of the tissues within it to be completely mobile, which is generally the nature of muscle tissue. We do want it to be able to maintain that shape. Also, the primary action of connective tissue is that it responds to pressure over time, meaning as there is pressure applied to the bladder, it will yield to pressure. This yielding to pressure is, one, how the bladder would void, but two, in the female body is essential for gestation. This is just an interesting male versus female anatomy. We actually have higher amounts of connective tissue in the female bladder than in the male bladder, right? And that's one, because it needs to be held within the pelvic bowl, right? Because there's, an open cavern at the bottom of the female pelvis. So we need more connective tissue to hold our organs in place, the bladder included, but also because we want it to yield to pressure and then stay where it's put. So as our babies grow within the womb and put pressure on the bladder, we want it to move out of the way and then stay in a location that is yielding to the consistent pressure within the trunk cavity, right? So it has this brilliant design that allows it to yield to pressure, that makes it useful for gestation, that keeps that shape of the bladder structurally integral, even while we have the immense pressure of growing a baby. So that's the use of the connective tissue. And then this muscle tissue that does allow it to expand and contract within limitation, right? And has this special innervation, right? The last thing that I want to talk about in terms of the anatomy and physiology is the placement of the bladder. The bladder is situated essentially right on top of the pubic bone, sort of below the uterine tissue. This is why if you are ever pregnant and you feel like your baby is actually sitting directly on your bladder, you're right? That your growing pregnant belly is putting pressure directly down on the bladder. And of course, in that circumstance, the balloon is not going to inflate to its fullest capacity, right? There is just structural limitation within the pelvic cavity. That being said, this is where understanding the innervation really comes into play as well. Because say you are pregnant and you feel like you are peeing constantly and you pee and you feel like 10 minutes later you have to pee again, but you haven't actually had any liquid intake. And then maybe you go to pee and not a lot of pee comes out. This is a question I got when preparing for this webinar, and I want to address it here because I think it really becomes clear when we start to look at the anatomy. This is an example of the bladder balloon and the stretch receptors in the bladder balloon being activated not from urine filling and expanding the balloon from the outside in, but maybe from a baby head or foot pushing into the outside of the bladder balloon and extending and pressing into those stretch receptors from the outside in. So yes, you are getting expansion of the tissue, but it's from the outside in, not the inside out, as a result of the pressure of pregnancy. So then you're like, oh, I have this feeling that I associate with having to pee, which is the activation of my stretch receptors in my bladder. And then you go to empty the bladder, but there's actually no urine because the way it was being activated was distinct from the urine filling from the inside out. Now, I like to bring this up because many women feel that they have to pee constantly during pregnancy. And then in the postpartum period, that sensation endures, meaning they don't immediately snap back to not having to pee all the time. They still feel hypersensitized. This is where understanding and starting to discern the difference between your nerve sensations in the bladder is, I would say, the first true key to bladder health and well-being. You can intellectually and somatically learn to distinguish the sensations between the bladder filling from the inside out and versus the bladder having pressure from the outside in. Again, it would generally only have pressure from the outside in during pregnancy, unless you had major, other issues with fibroids. And, we won't get into that specifically in this webinar, but for the most part, outside in pressure is due to gestation. That outside in pressure, one way to discern that from the inside out pressure would say, once you actively feel your baby moving, that could be a great indicator that that's where that sensation is actually coming from on the outside of the bladder. Also, intellectually, do you know if you've consumed liquid? So say you literally peed 15 minutes ago and haven't had anything to drink, the likelihood that the bladder has actually filled with urine from the inside out in that circumstance is quite low. And so therefore, if we don't go and void the bladder at that time or attempt to void the bladder, we begin to put into place a more accurate response to the nerve sensations that are coming from our bladder. Right? This is also really crucial for not hypersensitizing those stretch receptors, as we spoke about earlier, not consistently voiding and not having a really clear understanding. Is it outside in? Is it inside out? Do I need to pee or not? I feel like I have to pee and I'm just going to go try. Minimizing all of those actions and instead feeling, can I wait this out? Have I actually had a significant liquid? And then acting accordingly. So hopefully that is all clear. And if it's not, hop off or come on and turn on your mic and you can ask a question. But assuming that's clear, that's the basics of the anatomy and function of the bladder. Okay. So we're going to move from here into a really hot topic in regards to the bladder, which is bladder leaking. Bladder leaking is, I would say, the number one most common question that I got leading up to this webinar, this masterclass, and I want to address how it's related to the anatomy and physiology. One, we just spoke about the requirement of the bladder to be able to expand and contract and then be held in place by the connective tissue in order to function optimally. That basic structure of the bladder is crucial for maintaining continence, right? Bladder integrity. If we go from there into the innervation, the clarity of our nerve sensation and knowing, am I, is the bladder actually full? Do I have to void it now? Is another key component to minimizing leaking, right? So understanding what's going on in terms of the structure, as well as only actually attempting to void the bladder and therefore teaching the neurological patterns that you know the difference between when the bladder is full and when the bladder is not. So what does this actually mean for leaking? It means resisting the urge to pee just in case, right? And it also means really thinking about whether or not your bladder is full or not. Many women who struggle with leaking have this feeling that they kind of chronically have to pee. And that feeling is as much coming from the sensations of the bladder, which we just spoke about, how we can really retrain through what I would call good bladder pattern hygiene, meaning everything that we've previously spoken about, assessing accurately through our intellectual understanding, as well as our somatic feeling, what is happening in the bladder, right? And then practicing that accurately is going to help teach the nerves what to do. It's going to help teach the nerves when the bladder is full and when the bladder is not. So that's the first aspect of leaking. The second most common aspect of leaking would be a restriction within the tissues within the pelvic bowl. So I try not to say the term pelvic floor because it's not just the floor. And when we're looking at accurate female pelvic bony alignment, we're in this subtle anterior tilt. So then all these tissues might be better referred to as the pelvic back door and not the pelvic floor because they're somewhat behind us, right? So if we are in this anterior tilt, so with this untucked tailbone, it places these inferior bones of the ischial tuberosities, so these pubic bones here at the bottom, which can allow for more support of the bladder, right? More support of the bladder for a very baseline level generally means less leaking. Versus if we have this tucked tailbone posture, this uprighted pelvic posture, as well as say we're sucking back in with our abdomen or hugging in or wearing really tight pants, that's actively pushing pressure onto the bladder. And then there's not this support. So the bladder tends to generally descend in this structural moment. So if we have this degree of bladder descent, which might be called bladder prolapse, I'm not saying that all leaking has to do with prolapse, but structurally they are related, right? So if we have this pressure and we have this bladder descent, there is a lack of support, and that lack of support can often relate to leaking. Instead, let's think about what we do about it. So if we're in this more supported female pelvic posture and really have this set up that allows our tissues not only to be supported from our bony anatomy, but also allows for more buoyancy within the pelvic bowl. What I mean by that is our respiratory diaphragm and our pelvic floor, our pelvic bowl, right? Those tissues are designed to move together, meaning as we inhale, everything gently descends. As we exhale, everything extends. Again, inhale, everything goes down. Exhale, everything comes up. This ability to create this motion, right, to have this full range of motion within our pelvic tissues is crucial for remaining continent and minimizing leaking. Why is this? If the bladder is full, we need to be able to support those tissues. And what that tissue support is going to look like is largely an exhale. The tissues go from a descended position where they were in the inhale. The exhale, that support comes up, both being lifted up from the top and supported from the bottom to add that structural integrity so there's not inadvertent descent or leaking from the fluid, from the urine that's in the bladder. What occurs when we actually are sort of locked or restricted in our pelvic tissues or are reverse breathing, say like inhale and drawing up, this like suck in action and then exhale, letting go, we start minimizing this movement within the trunk canister. When we don't have adequate movement within the trunk canister, there can't be as much support, which is what would be required to prevent leaking. Let's think about when leaking usually occurs, which it's often in circumstances where you are coughing, sneezing, laughing. What are all of these actions? These are all strong exhalation actions, meaning in an optimal sort of function perspective, that strong exhale, and think a sneeze can go at 100 miles an hour, there's going to be a significant lift of both the pelvic bowl as well as the respiratory diaphragm. So exhale, all these tissues will lift up. That lifting up would help support continence in that moment. But if there isn't that full range of motion, or if there is some dis-pattern motion, think exhale, we sort of distend out, then when there is a forceful exhale, think like a laugh or a sneeze, and it causes that distension, we leak slightly because everything is pushing down on the exhale as opposed to lifting up on the exhale. So that entire concept could be called pressure management or breath control and pressure management within the trunk canister and the pelvic bowl. When we lack good structural integration and pressure management is when we leak urine. So what do we do about this? Right? This is an example where learning proper breath mechanics is going to be the first and ultimately most helpful aspect of minimizing leaking, right? These proper breath mechanics that allow us to exhale and have support of the tissues means that we're going to be creating this full range of motion and practicing that range of motion with every breath we take. Let's think about other things that can be limiting that range of motion, which would be restriction within the pelvic bowl. So say fascial restriction or muscle restriction. So connective tissue or really lock short or like tight musculature within the pelvis. It's going to really kind of hold everything still. If everything's held in that sort of restricted position, we're not going to have that full range, right? So what do we do about that? We're again interested in, yes, rhythmic breathing, which can do wonders for mobilizing those internal pelvic tissues, as well as myofascial release within the pelvis. This is where something like pelvic floor physical therapy or learning to do your own internal myofascial release can be incredibly helpful when addressing patterns of bladder leaking. Because if your connective tissue is significantly restricted, as I said, that's minimizing the motion. So you're not actually able to have all those tissues lift and support the bladder when it's full on that exhale in order to prevent that leakage. Okay, let's look at one more aspect here, which is supporting the musculature of our bladder, of our whole pelvic bowl in order to minimize leaking. So we talked about having this slightly anterior pelvic tilt posture, right? Which is optimal because the bone can be somewhat supportive of the bladder. But then how do we maintain this? Yes, the first thing is we develop spaciousness here in this bottom of the pelvis. So if everything is locked because maybe we've been doing our Kegels and sucking in our belly and squeezing our butt, right? And all these tissues start to come really towards one another, and we get this congestion at the bottom of the pelvis, right? And then we have this long sort of line in the posterior chain. So your glutes are long and weak. Maybe you can easily touch the floor, but you have back pain or sciatic pain. It's all related. It's all related to bladder leaking. And it's related because if we were to have the strong pelvic support, one, it would be drawing this tailbone back, which you can see would be creating more of that spaciousness that we previously spoke about. And it would also be assisting the pelvis in maintaining this particular structural alignment. One way to do that would be strengthening the muscles outside of the pelvic bowl. This has to do with our glute strength, our low back strength. So we're thinking all three glutes, our QL, our spinal erectors, and really our hamstrings down here. When all of these tissues are stronger, right, they specifically can help support all of the organs kind of back and up. Because if you think of these tissues are all, yes, they're on the outside, but they're connected to everything on the inside. So when everything is able to really contract and support, it in turn lifts the internal tissues, right? And that strong structure, that stable structure from the outside makes the pelvis supported so those internal tissues can move up and down with more success. So we say, what does strength training have to do with my bladder leaking? And I would say kind of everything in the sense that when we develop strong diaphragmatic control, so diaphragm here, respiratory diaphragm control, and join it with our pelvic floor mobility, and then add all that external pelvic musculature support, we start to put the pelvis in a position that is going to support the bladder. We start to give those internal tissues a fighting chance to be able to lift adequately in order to minimize any leaking. And we are able to hold the pelvis in that position due to our external sort of hip, low back, and hamstring strength. So when we start to put all those pieces together, then we create a supportive pelvic environment. And that supportive pelvic environment, of course, supports the bladder, whether it's full or not. That is true whether you're struggling with bladder prolapse or whether you're struggling with incontinence or leaking. Again, you don't have to have any bladder descent or bladder prolapse to leak, but all of these, aspects of our physiology of addressing from a respiratory perspective as well as a muscular perspective are absolutely going to help heal leaking and make it go away, as well as supporting any minimization of prolapse or pelvic descent that from happening in the future and or addressing it if it's happening now. Now, if you want more information on this specifically, like, well, what are the exercises? How do I do all of the breathing? I have a whole course about that. And so you can check that out. I have a whole strength training course that really focuses on pelvic stability. I also have a course coming forward about diastasis recti and prolapse, pelvic organ prolapse, which really gets into how do we develop that internal strength. But what I want us to look at, and external in the pelvis as well, but I want us to understand from a physiological perspective how that is crucial. So initially, say you're leaking, what do I do, right? 1, relax. Essentially, if you feel like you're about to sneeze, don't squeeze everything in anticipation. Don't like squeeze and hold, because what needs to happen is that exhale needs to and lift. And if you inhale and squeeze and contract, then there's nowhere further up for the lift to go. So it goes down and you leak. So if you feel a sneeze coming on, relax your pelvic bowl. If you feel like you're really laughing, relax your pelvic bowl. Don't clench, right? And then exhale fully to allow for that ascension. The other thing that I find really helpful, and I think sometimes we do this intrinsically, if you feel a sneeze coming on, I always say, I call it the flamingo sneeze, where you're going to shift to one leg. If we're thinking about why this would be helpful, is 1, just standing on one leg activates all of the musculature outside of the pelvis. And this external pelvic musculature, when it's turned on, again, if this is supporting on the outside, then the inside can relax because it has support. And when this internal tissue can relax, that means the exhale can sufficiently lift it to prevent leaking. So in the interim, right, as you're working to heal your leaking, starting with, yes, maybe shifting to one leg if you feel that that's going to happen, relaxing the tissues, right, and then exhaling fully to allow for that support. Every time you successfully move through those steps and don't leak when you jump or laugh or sneeze, you are actively teaching the body from a neurological as well as a muscular perspective better functional patterns for continence. So that's not like a Band-Aid. That is one tool on the pathway to healing, with the others being developing the biomechanical arrangement, meaning that pelvic tilt and the strength and the strength outside the pelvis and the inner pelvic mobility in the tissues. Okay, the last thing I want to talk about here, just because it's worth mentioning, that orgasm is a great way to mobilize those internal tissues. So if you do feel really stuck or locked up or restricted within your internal pelvic tissues, often having an orgasm or even just arousal can start to mobilize those tissues, which can give you a little bit more range of motion. So that's wonderful. I also know that this is another question that I got that I wanted to pepper in, which is leaking with orgasm, right? This is a good example of where you might have excess pelvic tension, meaning if you feel as though you're squeezing or bracing in order to orgasm. I know a lot of women clench or squeeze their muscles as they're approaching climax. This is a great example of where you actually want to relax all of the musculature, attempt not to sort of squeeze or tense as arousal heightens. So then when orgasm does occur, which from physiological level, orgasm is this sort of undulation and pulsing, lifting and lowering within our pelvic tissues, there is more range because you haven't been holding and clenching, and then you go to have this release with orgasm, there's nowhere to go. So things descend down and there's a release of urine. So relax, no clenching, which I know is really hard when we're like, oh no, I'm going to pee. But trust me, this aspect of minimizing pelvic tension is absolutely going to be a name of the game to prevent leaking and restore continence. Okay, so we went over the anatomy and physiology and function of the bladder, and we also just went over bladder leaking. Now, let's talk about common infections. So this is another common question that has to do with the bladder is I feel like I get chronic UTIs, or I have interstitial cystitis, or maybe you even get bladder infections. So let's initially start with the idea of what is an infection, right? And there's a lot of different thoughts on this. And, this could be a whole masterclass in and of itself of what is an infection. But I like to think about infections as being a imbalance in a specific type of cell tissue within the microbiome of the vagina or the ureter or the bladder, right? If we're speaking specifically about pelvic or bladder infections. So say if we think of something like bacterial vaginosis or a yeast infection, right? Or even a UTI, we're thinking there about how can I put this clearly? So in our vaginal microbiome, we have the presence of, as well as in our urinary tract microbiome, we have the presence of a variety of different types of cell matter, from virons to bacteria to fungal matter. And all of the cell material is normal and healthy and designed to be in this environment. When something sort of crosses over the threshold into being an infection is because there is an imbalance in the amount of a particular, say, viron cell density or fungal cell density or bacteria, if there's more of that specific type of, say, bacteria for a bacterial infection, then what would be sort of common in the environment of that microbiome. Why I like to bring this up is it is very, very rarely, and maybe never, a entirely foreign body that enters and reproduces within that structure, within that, microbiome. Instead, these are cells that live within this microbiome, but there is an imbalance that starts to occur, meaning there becomes more of one specific type of bacteria than another, more type of fungus than another, more type of virus than another, and the whole ratio gets thrown off. When that hits a certain threshold is when we would have something like a positive culture, right? So if we're thinking of chronic urinary tract infections or just urinary tract infections in general, and you go and you do a urine sample and then they culture it and they see that there is X amount of certain bacteria, that bacteria is likely in your urinary microbiome all the time, right? It's not an invader. It is just out of balance in relationship to others, and it has passed a certain threshold where it can now be detected through the type of culture that's being done in a urine sample. What does this mean? One, it means that the diagnostics of urinary tract infections are not an exact science, right? There's going to be a different threshold in terms of how much bacteria needs to be present in order to, or even how the culture goes, right? There's a lot of variables here. It's not cut and dry in terms of what would pop, say, like a positive culture. So just the idea of, well, I feel like I have something going on, but my tests are negative. I want to just really, trust and put some awareness into that context that there is likely an imbalance going on. And if you feel that, and just because it doesn't actually come out on, say, like a positive urine culture, doesn't mean there isn't some type of imbalance. So Then if we start talking about restoring balance, rather than say, I'm going to take an antibiotic for a urinary tract infection, which yes, that's totally your choice. But what I see happen, and what maybe has happened to you if you're watching this, is they come back, and often they come back in more frequent or resistant manners, and then they're hard to get rid of. Why I like to mention this is if we understand this idea, not about trying to kill a specific bacteria that is like conquesting into the urinary tract, but instead attempting to restore balance within our entire both vaginal and urinary microbiome, right? Then we're actually looking at what I would argue is the true issue, which the issue is the imbalance of that bacteria in relationship to others, not its presence in the first place. And when we have the use of an antibiotic, it doesn't do anything to address the actual imbalance that is potentially at the root cause of having these repetitive bacterial infections. In fact, it might actually worsen that root cause because it is wiping out all bacteria or much of it. And so as that microbiome starts to repopulate, one that takes more work, and there is more of a opportunity for an imbalance to reoccur if you're starting from scratch and not attempting to support healthy sort of ratios and relationships of fungus and virons and bacteria, but instead just working to kill. So what is this approach, right? An approach that is more interested in supporting the overall health of our pelvic health in general, as well as our urinary health. So how do we do that? What do we do with common infections, right? So many of you have like, oh, well, I've tried this. I drank the water. I drank the cranberry juice. One, like I hear that. And I want us to come back to just having a sense of restfulness, right? When we have elevated cortisol levels, that has a huge effect on our overall microbiome and is minimizing the ability for the body to do its regenerative healing work. So relaxing is really crucial. Another one that I think is incredibly helpful is the supplement D-mannose. I think this can be really great if you struggle with chronic infections. And I would actually utilize this far more than something like cranberry juice, which often can be adding just like increased levels of sugar, especially if it's not in your diet regularly, and might not be getting to the real root cause. Right. The other thing that I often suggest is what is actually going to create the environment for healing for an infection, which usually it's resting. Usually it is having feeling well fed, feeling well rested, not feeling super stressed. And I find that when we are treating something like a UTI, it's like it's kind of like the back burner often, where it's like, oh, how can I like get through this and just move on and have it go away and resolve as soon as possible. But say we were having like a fever or a cold, we might like take a few days off of work and actually do the healing that's required. And I don't want to just suggest that, oh, just drink some water, take some D-mannose and it'll go away. I understand if you're here with chronic infections, you're like, are you kidding me? I've tried that. But what I really do want to stress is, but have we actually given the body an opportunity to rest and heal in a way that isn't chronically also stressing about the symptoms that are occurring? And I find that there's a lot of women that I talk to, and it's like, well, I just deal with it while I'm going about my life. And I don't actually treat it as though there is an imbalance that specifically needs attention. So that is something I would just like to consider if you are struggling with these chronic infections. The other thing that I want to mention is that many women, myself included, when I thought that I had chronic bladder infections and chronic urinary tract infections, I was actually struggling with what is often pathologized as interstitial cystitis, which is essentially inflammation within the bladder, right? This inflammation within the bladder can give us that feeling of pressure and pain along the bladder. It sometimes comes with burning with urination, but often not. Right. It's just that feeling like you kind of chronically have to pee, but you can't quite empty the bladder. And it feels almost like you have a UTI, but then maybe you go and get a culture and it just repetitively comes up negative, showing that there's no infection, right? We already talked about how those tests aren't foolproof, but if you don't have any other symptoms of infection, but you just have these bladder symptoms, you might be struggling with inflammation in the tissue. So what do we do in that regard? One, allowing spaciousness within our pelvic bowl does wonders for minimizing inflammation and undue pressure on the bladder. Right. So if we are thinking about this tucked tailbone posture, these tight leggings or skinny jeans, this sucking back of the abdomen, right? We have this chronic pressure on the outside of the bladder balloon. When something is in chronic sort of pressure and restriction, that can cause an inflammatory response, right? That also, and then we start to have these inflammatory responses, then it's going to change our bladder patterns, right? It's going to cause, maybe more frequent urination. We're going to be minimizing all of that intelligent neurological function that we were speaking about earlier, right? Where we know when we go pee, when we have to pee, and we actually are really patterning and programming the bladder to function optimally, right? So minimizing that undue pressure is really going to do a lot, as well as minimizing other inflammatory responses in the body. What is something that really spikes inflammation? Well, stress is something that significantly spikes inflammation, but there's also going to be different food choices and different individual triggers for different women. We're not going to talk all about a whole anti-inflammatory diet, and I think that those really, really vary. There's not kind of a one size fits all in that way. But if you are realizing that you do just have sort of chronic pain and restriction, right? And you keep having negative cultures, looking at this from a structural perspective is often a great approach. Meaning, what can I do to minimize stress? What can I do to minimize inflammation? And also, what can I do to support the structure? So everything that we've said about strengthening these external pelvic external pelvic muscles, arranging this anterior pelvic tilt, softening the frontal abdomen. How can we really start to support this structure without adding pressure? Specifically, if that feeling of pressure is what is chronically giving you that feeling of infection or overall bladder sort of unhappiness, right? So, okay, if we're going back to this concept of common chronic infection, right? One, are you having actual UTIs and you're stuck in this loop of taking antibiotics to heal your UTIs? What can often be really helpful is stepping off that bandwagon and really optimizing and focusing on support for your overall microbiome. Again, ways you can do that would be, healing foods, drinking mineral water, drinking water that has, added salt and isn't just straight water to flush everything out. You're also going to do that by taking specific supplements, like I like the D-mannose. I also think that even working with things that can be flushing infection, such as like herbal teas, like oregano tea or calendula tea. There are all of these aspects we can be doing that are really focused on healing that urinary tract microbiome and your vaginal microbiome, as opposed to killing bacteria, right? Something else that I also can find really helpful is understanding whether or not we're actually having chronic infections or not, or if we're struggling with that inflammation of the bladder. If we are struggling with the inflammation of the bladder, things that minimize pressure on the bladder and optimize bladder placement. Also, do we have endless fascial adhesions, things that are just making us feel cramped and restricted, and all of the things that we've previously discussed about mobilizing those internal tissues and about having that external support and minimizing that inflammatory response is all going to be really, really helpful. So that's sort of the baseline of common infections and leaking. All right, from here, we're going to talk about urgency and frequency. We've already covered this, but these are questions that I got so commonly that I just did want to mention them. That immediate sense of urgency that I have to pee and oh no, I have to pee immediately, right? That to me is cueing an oversensitized stretch receptor within the bladder, right? So again, resisting that urge, right? Taking a few deep breaths and not attempting to squeeze or clench to hold, because that puts more pressure when we clench all around and cross the legs and do all of that, puts more pressure on the outside of that bladder balloon. So we're pushing from the outside, and then we already have those sensitive stretch receptors that don't like being pushed from the inside, and now they're being pushed from both directions. And then we aren't able to sustain the bladder, and we might leak, right, in that sense of urgency. I used to have an apprenticeship with a pelvic floor PT years ago, and she would always tell women if they felt like they were going to, start to leak, and because they had this sense of urgency, she would tell them to do multiplication tables in their mind, right? And while you don't have to do that, I did really like the idea, because it was something that was just taking your mind specifically off of the bladder, which allows generally for a relaxation of that contraction. And they found that often that could ease that immediacy and prevent leaking. The same thing goes with frequency, right? If you feel like you have to pee really frequently, again, starting to ease off of that, right? By actually understanding, do you have to pee? Is your bladder full? And going back to really discerning the difference between those varying sensations. Something else I want to mention here with urgency and frequency is diuretics. I think this is unique because these often come together in the sense that I hear women that feel like, oh, I have interstitial cystitis. I feel like I have to pee all the time. I have a little bit of bladder prolapse and I feel like I have chronic infections. And after I have sex, I kind of immediately feel like off in my bladder, right? They all come together, and often it's all due to these same factors, which is amazing because it means when we start to practice what we'll get to, these 5 keys, these 5 takeaways, we can start to heal and minimize a lot of the different bladder dysfunctions that we might be experiencing, right? So if we're thinking about something like a diuretic, which again, if we think like, oh, cranberry juice, right? And, or the most common one I would say is caffeine or coffee. When I have women that struggle with urgency or frequency, specifically in the postpartum period, and maybe you're tired and you're drinking a lot of coffee, often just the minimization of caffeine or coffee as a diuretic can have a significant impact. I worked with a client once who had really significant incontinence in the sense that she would have total losses, so meaning she would start to leak and wouldn't be able to control it, and had a complete inadvertent voiding of the bladder, right? And we did all the things we're discussing here: improving biomechanics, strengthening the posterior pelvis, minimizing pain, minimizing sort of anxiety and stress about the bladder, changing her neurological patterns. But the thing that really sort of took her from doing all of that work, but still not quite there, to continence was stopping drinking coffee, right? Just not having an active diuretic and caffeine bladder irritant minimize the sensitivity in her bladder. And that, in combination with the incredible structural work she was doing, she was able to regain continence. Now, guess what? She now can drink coffee following her second child, because she then went through a series of probably about a year, maybe more, of really practicing this stuff and like healing the bladder, right? And not having it become hypersensitized. So now if she wants to drink the occasional cup of coffee, she has the strength and structural integrity to be able to maintain continence with that additional bladder stimulant. So if you are struggling with urgency and frequency, diuretics, coffee, caffeine might be something you want to take out and see how it affects you. The other thing that I want to address here is water intake. Often women who struggle with bladder stuff drink a ton of water. And just in general, we're in a culture that's like, more water is better, drink a gallon of water a day. And I find that this actually can sometimes do more harm than good. Now, I trust women to assess if they're drinking enough water, right? I'm not here to tell you that there's like an optimal amount. I do think that, you're half your body weight. So if you take, I weigh 150 pounds, so 75 pounds would be half my body weight in ounces a day. Okay, I think that might be a guideline to work with. However, I'm not actually just drinking water. I'm finding other ways of hydration, meaning I might be drinking, at the very least, I'm adding minerals to my water. I might be adding salt to my water. I might be adding lemon to my water, or I might be drinking fresh juices, fruits, or foods that actually contain significant amount of water. If I am drinking tea, I'm being aware, am I drinking herbal tea that is full of diuretics, and which is often common, right? Not to knock it, but that can be something that is contributing to these, feeling like you immediately need to pee, or on the contrary, full of caffeine, which is also a bladder stimulant, right? So what liquids am I drinking? And this is where often the idea like, oh, I need to be peeing clear, right? I need to drink this much water in order to pee clear. I think that a concept of hydration can often kind of miss the point in terms of what we're actually doing to support our system overall, right? So in terms of water intake, are you over consuming liquids? And if you are over consuming liquids, which I would mean you're someone who's constantly drinking, constantly has, like, your hot frothy beverage that probably maybe has caffeine in it, and then you're maybe drinking a smoothie, and then you're also drinking your water all day. And that if you realize that you're actually consuming a lot of liquid, and that minimizing that and being sure that you're eating enough food, because I know a lot of women are drinking liquids in an attempt to, often minimize eating, right? If you're hungry or if you're trying to lose weight, right? So being sure you're actually eating sufficient calories and, not just sort of drinking to fill your belly. Okay. Now, there's not there's not like a hard, fast rule here. I'm not going to say this much water or this much liquid is too much liquid, right? But just being aware, do you constantly drink, right? Are you constantly thirsty? And in which case that might actually be an indication of like fascial adhesions and mineral imbalance rather than dehydration, right? In which case adding mineral rich foods to your diet, adding minerals to your water, really focusing on minimizing tension in the body, all of that's going to do a lot for that feeling of, for just being truly hydrated and nourished by your liquids, as opposed to just flushing out the body. Because often then when we drink a lot, then we flush out infection, right? But in turn, we can also just be flushing and minimizing our mineral stores, as well as in some cases, like minimizing that balance that the body is attempting to create, which would be preventing infection in the first place. So just a note to self about considering your water consumption and really thinking about what would be optimal in that regard. Okay. The last thing I really want to get to here is the emotional aspects of our bladder health. I know that for many of us, this is a huge piece. I feel like the fear that after I have sex, I'm going to get an infection, or I used to know that whenever I would get stressed, I would get a UTI. That would be like what my stress pattern showed up as. Maybe some people get a cold or get a cold sore or their back hurts when they get stressed, but I would get a UTI or a vaginal infection, right? I don't anymore, which is wonderful, right? But the response, right, our sort of emotional aspect really does have a significant impact. And I want to be really clear here. This isn't to say it's all in your head or that like our stress is manifesting our, bladder symptoms, nothing like that, but instead to actually take a integrated and a holistic approach to healing common bladder concerns. We've already talked about the bladder and brain training, meaning really how much we are able to accurately interpret the sensations from the bladder has a huge impact on our overall ability to void the bladder completely, to know when our bladder is full, and to not get into sort of improper habits for voiding and filling the bladder and frequency and urgency, which that all has to do with, honestly, sort of an intellectual or a logical approach to what the sensations that we're having. So not necessarily being immediately freaked out by what we're feeling, but say like, I have this urgent need to pee. Let me slow down, take a beat, and like feel into what's going on. Am I just really stressed right now? What if I just like took a few deep breaths, relaxed my pelvic floor, relaxed all of my tissues, and then how do I feel? Right? So that would be sort of one aspect. The other thing that I've mentioned earlier is stress hormones, right? Really our catecholamine system, which is epinephrine, norepinephrine, cortisol. And when we have these elevated catecholamines, right, these elevated, this elevated aspect of our hormonal blueprint, it is minimizing all other hormonal production in the body. That's how our stress hormones function. And when we do have sort of a minimization of other sort of hormonal production and activity, that's going to have an effect on our pelvic health overall, right? Now, I'm not saying specifically that it is necessarily affecting our bladder or our urinary tract microbiome, but it does affect the placement and the structure of our tissues. It also affects like our cycle and how our hormones are fluctuating in general. If you notice that you tend to have a urinary tract symptoms during the urinary tract symptoms during a certain time in your cycle, or you feel like you always feel like you're getting a UTI, or having bladder symptoms maybe right before your before you begin your bleed or something like that, really starting to understand that relationship between having a healthy hormonal blueprint and how minimizing stress and anxiety around not just your bladder, but in your life in general can be an incredibly important aspect to just healing your bladder stuff in general. Um, Another thing to just share about that within our cycle, if you are someone who does notice your bladder symptoms worsen in your luteal phase, so prior to your bleed, right, that is potentially an indication of just sensitivity and restriction in your tissues. As your uterus grows in size prior to your bleed, as your endometrial lining is at its thickest, right, and your uterus can expand up to 75% in size, like it can grow, that's then putting more pressure on your bladder. And if you do have this sort of sensitive or maybe reactive bladder due to all of the aspects that we've previously discussed, that can give you that feeling, that achy UTI feeling prior to your bleed when maybe you don't have an infection present. That would be a great time, again, to like slow down, relax, soften your tissues, maybe do some self-massage, maybe even do a vaginal steam, right? Things that can help just soften the tissues and see how that helps or can address some of your symptoms. The last thing I just want to mention here is if you are familiar with German New Medicine, which I am not a German New Medicine practitioner, but if you have never looked it up, this is a great opportunity to just give it a Google and check it out. But within German New Medicine, this is an aspect of thinking about how our emotional states really relate to our physiological states. It's a school of medicine that studies that connection specifically. If we're thinking of something like chronic urinary tract infections or specifically urinary tract infections after sex, German New Medicine shares that this is a territorial conflict. And again, I won't get into this in huge detail here, but the idea of essentially being out of connection and then returning to connection as having a relationship to your bladder or your urinary tract infections, right? So this emotional state of going from sort of a lack of connectivity to then feeling like you're back, like in your territory and really like with your, like with your mate, truly, and having that sort of reconnection established can result in the healing symptoms that are those of a urinary tract infection. So I just mention this here because I think that it can be quite relevant to a lot of women. And again, I'm not a German New Medicine practitioner, but I do think there is really something to be said for starting to explore or understand or look into the sort of the relational state and how it can relate to chronic bladder infections. Another thing that I have heard time and time again, and I just think it warrants being repeated, is I used to get infections all the time when I was with my ex-boyfriend or when my husband and I were like fighting a lot or really stressed. And either when that relationship ended or when, my husband and I got into a state of repair, my infections ceased to be a problem. I think there's a lot of ways we can look at that, but I hear it so frequently, and it totally has been true for me, that I would be remiss to understate how much our emotional states really do impact our ability, specifically within our pelvic health, to feel optimal and vibrant, and that isn't in and of itself a problem, right? This is where we can start to look at maybe bladder symptoms as an opportunity to slow down, assess, right? Nurture ourselves, heal our tissues, really tune in with what our body is saying, start to clarify our sensations, clear out some things that feel stressful. And most of the time, I see that result in a healing of even really consistent or chronic bladder concerns. So far, we have gone through sort of 5 aspects. One, which was the anatomy and physiology of the bladder, followed by leaking and how that is related to the structure and things you can do about it. We went through common infections and ways to think about infections and sort of what is an infection and how to address this. We've also gone through urgency and frequency and how they relate to everything aforementioned, and then also the emotional aspects and a truly integrated aspect of healing that isn't about you imagining or being too stressed out, but it really about like holding and tending to your bladder wellness as part of your overall health as a woman. Which is going to bring me to, and I know we're almost at time, but it's going to bring me to the 5 keys, right? The 5 keys to a healthy bladder, which are taken from these 5 aspects that we've discussed. And so if you are just like, okay, what's my takeaway? What do I do? This is your takeaway. All right. First one is bladder pattern hygiene. So this is the not, peeing all the time, essentially, and also not holding the bladder past a point of maybe 2 to 3 hours, or if you do have to pee, right? So really sensing and paying attention to how frequently am I peeing, and can I relax that and allow it to become within that, releasing the bladder, say every 3 hour range. If you're currently releasing the bladder every 30 minutes, great. We start where we are, right? But improving your bladder pattern hygiene would be, if I have to pee every 30 minutes, can I try and wait 5 minutes, and then every 35 minutes? And then the next time, can I maybe wait 10 minutes? And then I bet pretty quickly you're going to start to be able to pattern that, to change that pattern, which is going to impact the structure of your tissues, how your nerves respond, your neurology, what you understand in terms of when you have sensations from the bladder, right? It impacts everything, right? I'm not saying hold the bladder when you really feel like you're going to pee, right? But just starting to be aware and addressing the sensations and improving that bladder pattern hygiene. Okay. The next one is overall pelvic strength and integrity. If you follow me, this is the name of my game. I want us all to have strong, supple, supported pelvises. I want us to have strong external pelvic tissues and supple internal pelvic tissues. We create supple and mobile internal pelvic tissues through respiratory diaphragmatic movement, so healthy breathing and expansion of the lungs, ribs, and diaphragm, patterned with pelvic floor movement. We also do that through internal myofascial release and just really mobilizing the tissues within the pelvic bowl, as well as through sex and arousal. Those are kind of three great ways to be mobilizing the internal tissues, and then strengthening the external tissues. So I have tons of resources on, strength training for the female body and how to really be supporting our optimal pelvic alignment, right? So that how our pelvis is arranged, let that be a takeaway for bladder health as well, right? So bladder hygiene, 1, pelvic strength and integrity is number 2. The third one I would take away is water intake, caffeine, and diuretics. Be aware that you are, yes, drinking adequate liquids, and that those liquids are not just plain water or like a bottle of water, but that you're drinking filtered water, and that you are drinking water that has added minerals to it. Maybe you're adding your mineral drops. Maybe you're drinking other really high quality liquids, and noting that your high quality liquids that you're adding is not diuretic liquid. You're not just drinking endless diuretic herbs and herbal teas. And you're also not drinking a gallon of water a day, because often that can be flushing out of our system, which, though in the name of, flushing infection, can sometimes minimize the actual requirement for our body to be able to retain minerals and, really work to support our overall urinary tract and vaginal microbiome. So understanding the relationship between caffeine, diuretics, and water intake, not too much, not too little. And I totally trust that you can figure out the right balance for you. The next key, so number 4, we're looking at really mental wellness, right? So I say this obviously, I'm not a little tongue in cheek, but what I mean by that is, what's going on? Are we incredibly stressed and run down and sort of unwell? And is that showing up in our bladder symptoms? And how can we arrange our life and really our emotional states and our, the care that we're providing ourselves to be prioritizing the ability for our bodies to heal? I also, I can't not mention here, our relationship with partners that we are having sex with, because so often, as I mentioned before, that's an aspect of it, of relationship stress and chronic urinary tract infections. So knowing that, maybe when you're well, things are well, and when you're not, those can flare up. So just something to consider there. And then the last key would be to slow down. I know, right? You're like, what? How is this related to my bladder? But truly, right? Everything that I have mentioned, the 4 previous keys, practicing good bladder hygiene, taking the time to strengthen and support the structural integrity of your pelvis, really discerning what you're putting in your body in terms of fluid, and is it optimal for you? Really taking the time to tend to your sort of emotional state all requires just the sense of, I'm going to take a slower and less pathological approach to your bladder health. Right? So less, is it this infection? Is it that infection? What do I do? I'm leaking. Oh no. And instead slowing it down piece by piece, implementing these steps that aren't designed to pathologize anything with the bladder, but rather to optimize healthy bladder function. And if we really slow down and take the time to do that, it's not a quick fix often. Sometimes it takes a matter of weeks or months or maybe longer, right? But really taking the time to support our overall bladder and pelvic health wellness is going to be crucial for our long-term pelvic health and integrity, right? One more note here about slowing down. I should have mentioned this earlier. The power pee, right? Where you like hover over the toilet maybe, or you like force your pee out so you can pee as quickly as possible. Just give that up. Take an extra 20 seconds to empty the bladder, right? Breathe, relax, and just gently void the bladder. Those 20 seconds, take another minute, right? Maybe put your phone down, right? If you're someone who does that while you're voiding your bladder, and just like, don't power pee, you're adding more tension. It's like minimizing everything we've spoken about earlier. So just the whole thing, taking a slower approach. So those are the 5 keys. I hope that gives you a lot of information about the bladder. I think that I have gotten to most questions, but let me just scan these, and hopefully that you will feel like you got them answered. So there were several about leaking and coughing. What can you do? I think we covered that. Finding good pelvic floor therapist near you. I mean, the Pelvic Guru, they have a directory that you could maybe utilize. Also, I see women all over the world, so you can book some one-on-one time with me. I also am leading a radical pelvic health intensive where we'll be teaching you to be doing your own internal pelvic work, as well as all women will have the opportunity to have that from a professional while we're there. So that's in August of this year, 2023, if you're watching. So Radical Pelvic Health Intensive would be a great one to teach you how to do this for yourself. Let me see if there's any else. Okay, this is one that's sort of about prolapse. I feel my bladder bulging out of my, out of the opening of my vagina when you go to void the bladder. 1, do not power pee, right? Don't force, relax. You can also support the bladder internally if you'd like, right? Urine is not a problem if you get some on your hands, right? But that is more of a prolapse, like a bladder prolapse situation, which I do have a whole course coming out that's about healing bladder prolapse, or healing prolapse in general. I also, if you're watching this right now, I have a webinar or like a masterclass on prolapse specifically, and the content from this masterclass as well as that one would be really helpful there. So that, and also everything we've talked about here, it's spoken about in this masterclass would totally be relevant for healing prolapse too. Okay. This is more just about leaking. A lot of you are going to have healing in regards to your bladder leaking. Okay. Starting 3rd pregnancy, should I have to get up to pee throughout the night? Yeah, most pregnant women do have to pee throughout the night. That, if you feel like you're peeing 10 times in the night, then that would be, a situation I would say is, you likely are having that oversensitivity to, the bladder filling, right? That sort of hypersensitivity in your stretch receptors. The other question I would ask is, are you fully voiding the bladder, right? If women go and they like pee a little bit or but if your bladder is totally full and emptying, then, I would also consider your water intake. Are you drinking diuretics? And if you are peeing a lot in that regard. And okay, since pregnant, I'm totally wetting my pants when I pee, but normally I don't, right? Wetting my pants when I pee. I think what she means is there's just a sense of urgency. Like she has to go to the bathroom and it's like, oh no, I get there and I like can't quite make it. as a good example of the mental capacity of releasing the bladder. If we've been able to hold it for 30 minutes, but then when we're in the bathroom, we start to leak, right? That largely has to do with just the tension that we've associated with holding the bladder and starting to repattern and work to release that tension. That's a great moment to do those times tables, right? Would be a really helpful way to minimize that like peeing prior to actually releasing the bladder. So being able to minimize that urgency, specifically if that urgency is right before you have the opportunity to void. What if it's hard? I like this question. This is the last one I'll take here. What if it's hard to fully empty the bladder if I don't sort of push? Right? This is a great example of having likely conditioned all the tissues within the pelvis um, to be kind of restricted, if that makes sense. So that feeling like, oh, I have to like push my pee out as opposed to having a spontaneous contraction within the bladder. Is something that can absolutely be reestablished. It's not a quick fix if that's your situation, but instead it's minimizing that and really working to breathe and descend. Also, sometimes massaging the front of the abdomen can be helpful. Also, sometimes standing up and sitting back down in the toilet can be helpful. The last one that can be useful here is a subtle stimulation, sometimes around the clitoral hood, on the labias, or right at the top of the buttock crease. These are all really strongly innervated areas. And I find that often just like gentle touch, sort of like tickling touch, can just like send those sort of like shivers, which can help the bladder like, again, release slightly more. So those would be all sort of in the moment techniques. The other thing that I would consider is, do you just have a lot of restriction within your internal pelvic tissues? So are you, all the stuff we've talked about, do you feel sort of locked short within the pelvis, right? And you really need to like force, right? And everything out here might be more lax, right? And if we think about the physiology of that, if you're like, oh, I really have to like push to have this go down, right? To have like the urine void through the ureters, right? Then I would think about, okay, well, what would allow the bladder to expand and contract more fluidly, right? Which this would largely mean a softening within the tissues of the pelvic bowl. There could also be something going on here, which could be an over-laxity around those tissues, which is likely something I usually see with women who've either had, subsequent children or are later in life through perimenopause or menopause. I don't know if that's your circumstance. And if that's you, there's a slightly different approach. So if this is your question, there's really not a one size fits all. But my first thought is, if you're like a young woman and you have to push, it's like over tension. And if you are a woman who is in midlife or later and you feel like you kind of don't have any sensation to pee, right? And you kind of have to push to void the bladder, then we're dealing with an over laxity within the tissues of the bladder, and likely dealing with some pelvic descent, and then working around prolapse and learning to sort of re-stimulate the nerves in that region is going to be a course of action. So that one's a little more complex, but I do think that we can start to really think about what's logically occurring and discern for ourselves. Okay. I hope you found this masterclass to be useful and that you I feel really armed with a lot more physiological and hopefully applicable and helpful information regarding your bladder and how to keep yourself healthful and continent and comfortable throughout the entirety of your brilliant female life. And I know that I just spoke a lot, but like truly, this is actually only the tip of the iceberg. There is so much more we could get into in regards to not just our bladder health, but how it relates to our pelvic health overall. So if you have listened to this, and I hope that you can just go and implement some of this stuff and start to see improvements. If you do feel like you do need more support, please reach out. I see women one-on-one in my Well Woman Care practice, and I've helped so many women, myself included, heal from chronic infections, interstitial cystitis, prolapse, bladder leaking, and all the rest. So that could be a way that we could continue to work and I could continue to support you. As I mentioned, I also have other courses that would be useful. So if you're struggling with prolapse, I do have a huge, large course coming out all about healing diastasis recti and prolapse, as well as preventing those issues. So that would be really useful. And we talk a lot about leaking in relationship to prolapse in that course. I also have a strength training for women course, which is going to help sort of understand and really implement that structural integrity that I was talking about being so crucial to our overall pelvic health and wellness. And if you are into this anatomy aspect, I also have a foundations of female anatomy and physiology course where we talk about different structures and systems in the body. So you can start to just deepen your understanding of the body more and more, because really this information is available and observable for all of us. And the more we know, the more we can really care for ourselves, because that's what's ultimately needed for us to live healthy, long lives as women. So lots of ways to learn. Please reach out if you have any questions, and we'll talk soon.